Crowds of current and former CDC staffers and their supporters lined the streets of Atlanta yesterday to recognize the officials who resigned in protest after the ousting of CDC Director Susan Manares. Now we're learning more details about what led to that firing and to the exodus that followed. As NBC News reports, an escalating conflict over an influential vaccine committee was one of the final straws. Health and Human Services Secretary Robert F. Kennedy Jr. had reconstituted the committee, you'll remember, by firing its members and appointing new members, including vaccine skeptics. Well, Manares reportedly refused to rubber stamp the panel's new vaccine recommendations, and she objected to firing members of her team. Hours later, she was pushed out. Other top officials who resigned also cited concerns with the committee, including a guidance document that ignored all feedback from career CDC staff. Republican Senator Bill Cassidy of Louisiana, who chairs the Senate Health Committee, is now urging the postponement of the vaccine approval meeting set for next month, saying, in part, quote, if the meeting proceeds, any recommendations made should be rejected as lacking legitimacy, given the seriousness of the allegations and the current turmoil in CDC leadership. Jayma, let's start this morning with you. I mean, I feel like all of the stories we have are tied together. This is all this big remaking of America. Ezra Klein at the moment is calling it an optical illusion. We see all these big things happening, but we don't quite know what they mean or where it's going to end. Talk first about the CDC. How serious is this?
Well, it's profound. And you saw the outpouring of support in the streets of Atlanta. You don't typically see government employees throwing bouquets to their bosses outside of federal agencies. Let's put it that way.
Let's see. Employees full stop throwing bouquets.
Yeah, exactly. Federal or private sector, it doesn't matter. So it's profoundly serious in the public health sense. Kids going back to school all across the country last week, this week, next week. And obviously, it's an issue of huge concern. The politics of it are extremely delicate because the now former head of the CDC thought she had an ally in Senator Bill Cassidy, and in her final hours there reached out to Bill Cassidy. Cassidy, I know, tried to help her, and it was too late. And effectively, the White House sided with Robert F. Kennedy. Cassidy's in a difficult spot. He's facing a difficult primary next year in Louisiana. He already voted to impeach Donald Trump in 2021. So politically, he's in a precarious spot, needs Trump's support, but he's a doctor. He understands the importance of vaccinations, especially with kids.
And by the way, he was hesitant about supporting Kennedy.
Precisely because of this issue of vaccinations. And he thought he extracted some level of commitment from Kennedy. It turns out Kennedy is a vaccine skeptic for a reason. And of course, he was going to try to overhaul this committee to load it up with vaccine skeptics. And here we are a mere 7 months later. Sam,
this is the president, isn't it, in the end?
Yeah.
Deciding that, OK, he himself may want to tout his successes, as we've been hearing he's been saying to donors. I want to talk about the things I did during COVID and that amazing COVID vaccine rollout, but realizing that his MAGA base is full of people who are vaccine skeptics, and he's kind of caught between a rock and a hard place.
I don't know how much Trump cares about the details so much as the accolades. And he has always been a little bit of anti-vax curious, even prior to his political runs. But he also loves the fact that Operation Warp Speed was a major success. I've been a little bit surprised, I guess, maybe I shouldn't have been, about how much leash he's given Kennedy. Because Kennedy has dramatic...
Yeah, me too, actually. Why?
I think he likes the fact that Kennedy completed the ideological horseshoe from him and brought in all these voters and helped him win. And frankly, I think he values that more than anything else. But Kennedy has also taken...
Kennedy, too. I mean,
yeah, he's a Kennedy, right? Like, he loves the idea. Yeah, the idea...
20th century prestige and Donald Trump. I mean, that's just easy,
exactly,
right?
Exactly, yeah. And so I think he diverted my train of thought. But Trump,
you can do it, Sam.
I figured it out. But Kennedy's impact on our public health in America has been more than just profound. It's been damaging. And the chief achievement of Operation Warp Speed was to use mRNA technology to get a life-saving vaccine to market and online in way faster amount of time than any prior vaccine had come online. Kennedy has now taken concrete steps to end the use of mRNA technology that could have profound impacts, not just for future vaccinations, but for cancer treatments. We're talking about people who will die because of this. We're already seeing this morning the implications of what he's doing to the advisory role committee at CDC around vaccines. There's an article in the New York Times about CVS pharmacies in 16 states not currently offering the COVID vaccine. Now, I know people don't think of COVID as a big deal anymore, but it is a deal. And people there is a big portion of the public that wants that vaccine that in 16 states cannot get it at CVS right now. That has a huge impact on people. That has a huge impact on health. And this is just the beginning. That advisory committee still has not met. Bill Cassidy says he doesn't want them to meet now. This is chaos at the highest levels of our health agencies. I don't think the public is going to like this if they can't get access to the vaccines that they want and that they need.
David, if we're talking about, and we look at all the stories we're going to be covering this morning, there is a very profound remaking of this country going on, and the remaking of the country's health and the remaking of America's relationship with science and data seems to be at the center of this. When I put my kind of look at America from the outside hat on, this is a country that is not recognizable when it comes to its relationship with science and scientific progress. This is America that has touted its scientific progress ever since the Second World War, that's been at the forefront of scientific progress. This is the country people from around the world want to come to study science, to study medicine, because America is in the forefront.
Yeah, Katie, I think of all the things Trump has done, the actions against public health agencies, against university research, against the things that we think of as being outside of politics, could prove to be the most damaging, the hardest to repair. These are generational projects. Laboratories at great universities get broken apart. People leave, go to other countries. Other countries are actively recruiting scientists from the United States. It's going to be very hard to get them back. So, reading this morning in the New York Times about the scenes of despair at the CDC, these are professionals who really came into the public health business, not all that well paying. If you're a doctor, a medical professional, they came in to try to save lives with a sense of responsibility. The CDC was one of those agencies that was acting on behalf of the public. If there was a crisis, a sudden outbreak of a virus, infectious disease, they were the people who were on the front lines. That's how they saw themselves. Now they're getting shot at. People who think their health problems are to blame for COVID vaccines. One man began literally shooting at the CDC headquarters. Their leadership, trying to stand up to what I see as political directives, are being fired or are resigning in protest. And this great institution is being shredded. And it's really going to hurt all of us. That point was made so well by a former CDC chief, Tom Frieden, on National Public Radio last night. This is something that we depend on, and it will depend on more and more as new viruses, new diseases begin to hit us. What are they? Yeah. Where are they? How do we stop them?
You raise an important point, too, because we haven't had a crisis yet. There hasn't been an outbreak of a new strain of COVID. There hasn't been, thank God, any kind of a terrorist attack on American soil. What's going to happen when all these agencies that are precisely designed to deal with such tragedies, traumas, crises have to respond to that kind of thing? And that's really troubling.
Yeah, this is in the front line of protecting us all. And what happens when some of the top researchers in the country are no longer working here protecting America, but they're working, and I know I've spoken to heads of universities in the UK, they are quite happy to offer these people jobs.
Everybody's poaching America.
Including
the
University of Hong Kong, whereas the Chinese are also happy to say, come to Hong Kong. Yeah. We'll take you quite happily.